Now from the 12 News I-Team, Arizona insurance regulators are asking the state attorney general to open a fraud investigation into a company called Thin Blue Line Benefits. The company marketed insurance plans to retired firefighters, police, and their families.
It sounded good, but then suddenly they stopped paying the medical bills, leaving a lot of good people in the lurch. Now the I-Team's Katie Wilcox shows us how Arizona and Ohio are handling consumer complaints and why one organization is strangely staying quiet. Katie?
Yeah, Mark, Troy, thank you so much. The Thin Blue Line had about 8,000 members just in Arizona and Ohio, and we don't know how many there are throughout the rest of the states. And one key advocate for Thin Blue Line, a partner really, was the National Fraternal Order of Police. But now that states have taken action against the company, the NFOP is cutting ties. When a company promising health coverage to first responders came to Arizona,
and they started off awesome.
it was embraced.
They were a little bit cheaper.
Something a massive police association encouraged members to join.
Exciting news for Fraternal Order Police members.
It promised something special. This was NFOP President Patrick Yos.
We have partnered with Thin Blue Line Benefits.
Thin Blue Line promised its customers all the benefits of insurance.
Groundbreaking health insurance options.
But the company told state regulators they were not an insurance company.
This organization that was selling the health plan was indicating that this was an association health plan, but an association health plan is only offered to employees.
Chris Condalucci, an expert in U.S. health insurance law and policy, joined me from Florida.
So this organization was misrepresenting. It's not an association health plan, and misrepresentation is a violation of the law.
He said the company is accused of trying to categorize its operation to avoid accountability.
An organization will say, we're a group health plan, and therefore we are regulated by federal law, and we are exempt from state law.
And so there was this gap. The Fed pointed at the state and the state pointed at the Fed. It seemed as though the back and forth pointing at each other allowed Thin Blue Line to operate for a couple of years.
Like, people need to ask more questions. You need to look underneath the hood.
Since the I-Team first started reporting on complaints about Thin Blue Line in February,
Discover the details, plan options, and rates at our website.
that website has come down. The NFOP's general counsel told the I-Team they terminated their agreement, and they also shared Thin Blue Line's statement on their website, saying it's cooperating with the Ohio investigation and that medical claims through June 1st have been paid. But that's not what regulators and members say.
They say I owe $89,470.
Now, Thin Blue Line's been ordered to stop operations in Ohio and Arizona. The Ohio Attorney General is working on a process to get the money back.
I think it's a big Ponzi scheme that they don't have money to pay the bills.
What is really the difference between an unlicensed insurer and a Ponzi scheme?
I don't think that there's much of a difference.
Thin Blue Line has not responded to 12 News' repeated attempts to reach them for comment. And the Attorney General here in Arizona has also declined to comment on this reporting so far, but members that I spoke with are filing complaints and hope that the Arizona AG will act quickly to help them recoup whatever money they can get.
Yeah, because does this company even have any money left? Is there anything to get if they're found in the wrong?
I mean, that is a great question. Now, what we do know is that based in Arizona, they've received about $6 million in just premium payments since the beginning of the year. It's unclear exactly how much that is in Ohio. And again, they're operational across the country. So they've been bringing in premiums. We're just not sure where the money's going out.
And caught in the middle between this tug of war between the state and the Fed, these first responders and their families who now could really be in trouble financially.
Yeah, absolutely. I mean, some of them have told us that they are. We know in Ohio, there was one person who reported having bills for $270,000 left standing. I've spoken to multiple, even another this morning that's looking at $40,000 bills. Again, we don't have the full picture yet because that's not been reported to state governments, but that is the question that we're continuing to ask.
Yeah. Looking forward to your ongoing reporting on this, Katie. Thank you.